Ladies and gentlemen, once more we are on air to talk about what we discussed last time, the role of women, post-menopause women in making sexual life of the man a pleasurable event, as well as for herself. And we have none other than Dr. Sharmila Majumdar, who's India's first female sexologist with a PhD from Mount Sinai School of Medicine, USA. She has a fellowship of cognitive behavior and management in sexual health. Dr. Sharmila, thank you very much for coming back to us and welcome back to the channel. Now, we were talking about post-menopausal women and their attitude towards sexual behavior, towards their sexual encounters. We talked about what are the problems that the women in this age group face, lubrication problems, hormonal problems, and we talked about the comorbidities that they have, diabetes, arthritis,
cardiovascular disorders, urinary tract diseases, cystitis.
Great. Now, that's all right. But what do we do? How do we go about explaining to the woman or to the man what they should do to enjoy a good sexual life, which is so very important?
Yes. Compliance with medical instructions by the doctor definitely helps to control unpleasant symptoms of comorbidities after menopause and physical and psychological status changes. So please seek help. Do not hesitate. Every woman goes through it. It's a part of nature. Consult a sexual health specialist, a sexologist, or an andrologist and discuss your problems. Do not think that menopause is the end of your journey. As a matter of fact, the more you are attached sexually to your partner, the more you feel the entire happiness. You feel happy about your whole life, about different compartments of life. So having said that, please continue to take the medications, whatever has been prescribed by your other specialist for your diabetes or hypertension or arthritis or cardiovascular disorder. But also please tell them that because sometimes these medicine in itself causes the sexual dysfunction is a side effect of these medications. So you must be aware of it. Please do not hesitate to ask your cardiologist or your endocrinologist for a minute. Please do not hesitate because it is your sexual health. So compliance with the treatment have direct and indirect or iatrogenic effects on sexuality. So please do not give up the medications until and unless advised by your doctor. Please consult a sexual health specialist in person so that or through a video call. Nowadays, we have video consultation and audio consultations available so that you get to know, what are what exactly can be done, what medications are there, which we cannot obviously prescribe in a show, but we can give you a little bit of guidance and we can help you ease certain issues. So first thing, compliance with your medical instructions.
Dr. Sharmila, at this point, I'd like to say that there are certain medicines which themselves can induce sexual problems.
Absolutely.
So if you have noticed any difference in your sexual behavior following use of a particular medicine, go back to your doctor and don't hesitate to tell them about the problems that you're facing following use of the medicine. Particularly in men, they may start losing their erection. Many of the blood pressure tablets that we take have a negative effect.
Even the beta blockers, everything, they have a profound effect on sexual health for both men and women.
Yes. The good part is that there are antihypertensives or anti-blood pressure tablets which do not have or have minimal effect on the sexual organs. So the person can be switched over to that particular brand. So we talked about compliance,
and sometimes because the wife or the partner the lady partner who has attained menopause is undergoing comorbidities along with menopause, it affects the partner. He has a they are very concerned, and they also take a step back because of the suffering, the physical suffering that his wife is going through, and they go through fear, they go through avoidance. They go through loss of libido, fatigue, role changes. So in such cases, communication skills play a major role in dealing with the disease and your partner's hesitation, talk about it. There is nothing more better than to start communicating with your partner first. Discuss your issues, where your pain is, where your trouble is. Take 5 minutes out and discuss the problems that you are undergoing with your partner. So communicating is very important.
Very, very important point that you
Very,
raised.
very important.
In Indian culture particularly, people don't talk about it. Even the husband and the wife in the whole lifetime.
They avoid it completely. Even the young couples, it's just not the menopausal couples. Even the young couples, they avoid it. And when situation comes to almost a divorce, they run to a sexologist because of several problems that they're undergoing. So once you come to a specialist, there is a tailor-made and personalized psychosexual counseling given along with medication. So these two help in aid in the management of all the issues that you're going through. Let me also point out that lady patients who are undergoing having diabetes or hypertension, just with lifestyle modification, they can really manage both diabetes and type 2 diabetes. Especially, they can reverse it. They can also manage their hypertension. Good diet, little bit of exercising, strengthening the core, and good sleep, mindfulness, practicing mindfulness, being positive about life in general. All this is going to help you a lot. So diet and exercise plays a very big role in diabetes. Your blood sugar level can be easily controlled slowly and steadily. It will, with good diet, proper diet, just cut away the carbohydrates and the sugar and the unhealthy fats from your diet. Follow a more protein-based, a mineral and a vitamin-based. You can take supplements of omega-3, and you can take calcium and vitamin D. These things will help you a lot. You can take anti-inflammatories like vitamin C or curcumin, which is there, which it's really going to help you. It will also help lower the blood sugar level.
So really, pills are a part of the treatment. They are not the whole and soul of the treatment.
Yes.
Lifestyle modification is equally important.
It's very important. Just by swallowing medicines, from metformin, you're going to go to insulin. But if you're going to take control of your life and you're going to say, I'm going to invest an hour in walking every day, you please see, I mean, you should be also in the appropriate weight. In case you're overweight, try to lose weight. Even 5 kgs makes a lot of difference. Your blood sugar level will really come down. So will your blood pressure points come down, and that will be the beginning. That will motivate you. So having the healthy weight is extremely important, because after menopause, because of declining estradiol, women tend to put on weight. They tend to put on weight, and that is
right.
One of the precursors of many diseases, very unknown to us. It's one of the precursors. So if you're going to do yoga, meditation, just walking, we are not advising you to go in for heavy high intensity training, because we understand you might have arthritis and other issues. But just walking, standing on your leg every hour. Don't always sit and sleep. Try to be physically active. That itself also. And devote some time to exercises, like just walking. Take this 1 flight of stairs or 2 flight of stairs as you're comfortable. Eating healthy is extremely important. Leafy green vegetable, red fruits, colorful vegetables. These are extremely important in your diet. Water-based vegetables like bitter gourd and, in Hindi we say lauki and turai, bottle gourds and snake gourds. They are all water-based vegetables which have a negative calorific impact on you.
And easily available.
So diet and exercise, these two can really help you beat diabetes. Please cut away sugar, salt, and white flour from your life.
Let's talk about yoga. You mentioned yoga. Yes. I think that should come in a big way.
Absolutely.
Because if you do meditation, you not only calm the body down, but also release happy hormones.
Yes, absolutely.
Which again help in improving the sexual life of both the partners. And yoga needn't be a very extensive yoga, as you said about the exercises. Gentle yoga will do just as much.
It improves the flexibility, it improves your mood, it improves a lot of things. Like Sir said, releases happy hormones. There are 4 happy hormones released from the brain. So there's a lot of benefit in yoga. And mindfulness, practicing mindfulness, that's also extremely important. And communication. These are very few things. When we did the study, sir, you'll be surprised to know that Indian women would never ever speak about their discomfort in their sexual health. But the good news is, when the doctor initiates a conversation, they do open up and they do say that, yes, we have this problem. So it's very important for all the doctors to try and initiate, because every human being is a sexual human being. So we need to respect that. And no matter whether it's a cardiologist or an endocrinologist or a sexologist or a urologist, I mean, just an extra 5 minutes in asking about the sexual health of an andropause or a menopause. My term is couplepause. When this two occurs to a man and a woman, it's couplepause, sir.
Yes, very true.
Yes.
And here's the sad part, because we doctors in India don't ever think of talking about sex, firstly, with our patients. And secondly, even if we do talk about it, we don't give them this lifestyle management, which is so very important before they start with drug therapy.
There should be some workshops, and sexual health workshops, and some, apart from psychosexual counseling, some sexual health workshops for women attaining menopause. So that will be very helpful. They will come in a group and they will not be hesitant. And, the doctors just spends half an hour giving a small presentation, and they will take back a lot of knowledge with them, which they might implement and benefit immensely for the rest of their life.
Quite right. We could try and do that on this channel, provided we get a good feedback about that. So that's a point that you raised very rightly.
So because every woman's personality trait is different, they think, behave, react differently, their social economic status is different. So we need to have a very personalized, a customized, a tailor-made psychosexual counseling for every patient or couple. That's what is my observation thus far, sir.
Now let's come to the medicines. Lubricants we were talking about last time. What kind of lubricants?
Water-based. Only water-based, not the ones which have fragrance and artificial preservatives and colorings. No, please. Just water-based. If you do not get a water-based lubricant, use ultrasound gel. That's fine. Or you can use KY jelly. That's another very good lubricant, which is just simple water-based gel. So you use it not only on the ladies' private parts, but also the man's erect penis. So there is proper lubrication. Sometimes they just use a little bit, a drop. That is not going to help. So it should be on the erect penis as well as on the vagina. So
what about lubricated condoms?
That's for menopausal women hardly works.
Okay.
Because since there's no fear of pregnancy, they prefer to go without condoms. So in that case, water-based lubricants are an ideal choice.
And the other thing is, by the time the man puts on the condom, he loses his erection at that age.
Yes, that's very true.
So, right. Now, do you think that hormone replacement therapy will help improve the sexual function of a postmenopausal woman?
Well, it is recommended, but again, it comes with its own set of side effects. So the patient, it depends completely from one case to another. Suppose a patient has 3 to 4 comorbidities, then we discourage because, as you know, hormone replacement therapies do have concerns about side effects, like it could end up in breast cancers or
into nasty ovarian tumor.
Yeah, so they are natural phytochemicals, including a lot of soya beans, pomegranates. In your diet, they have natural estrogen. You don't have to really resort to HRT, hormone replacement therapy. Even the diet is so potent, it's so powerful and healing for every human being if it's taken rightly. So,
and particularly our vegetarian Indian diet.
Yes.
Green leafy vegetables.
Absolutely. Colorful
vegetables. They are so good. And as you mentioned, pomegranate is one of the best.
Pomegranate, yes, soya beans, soy milk. There are so many things which has natural estrogen and which can benefit the lady.
Yeah, right.
So I would not really, jump for an HRT immediately. We could always see with lifestyle modification and natural phytochemicals. And if the lady is able to control her comorbidities or does not have comorbidities, then we can try HRT for a short time and see how it is helping her.
Is there a female Viagra?
Well, ADDY, as you know, is it's a psychiatric drug. It's actually an SSRI. It's an antidepressant, but it was released in America. But it has a lot of inclusion and exclusion criteria. It has a
You're
lot
talking
of
about a pink Viagra.
Yes, ADDY. It's called ADDY. And unfortunately, it's not available here in India. It's not yet available. And even women who have taken this pill, it causes a lot of blood pressure fluctuations, and there are a lot of issues. You need to, and again, another thing is ADDY is basically for perimenopausal women. It is not given to menopausal women.
Right.
It is not for them. So,
and in any case, it's not been that effective.
It's not that, as the whatever research papers I've studied, it has, but it has a lot of lengthy list of do's and don'ts. So even the young women are pretty hesitant in taking. But sir, research also says that Viagra in a very little, small dose taken by women, it has the similar effect in boosting the libido desire.
Keep the dose secret unless the women start misusing it.
This has to be prescribed. This cannot be disclosed over a discussion. You need to go to doctors and legitimately get your prescription, and if they deem it fit, they are going to guide you. So please go to Dr. Ajit Saxena, sir. The patients who are in Hyderabad are most welcome to consult me, and there are
better still, Dr. Sharmila Majumdar, who is a female sexologist.
Yeah, women they can connect to me from anywhere in the world thanks to the video consultation facilities. It's not an issue at all. Like, they have to be physically present. So Corona has given us that one benefit.
Because if one of you wants to contact Dr. Sharmila Majumdar, put it in the comment section and we'll give you the telephone number and pass on the number.
Yeah, they can just log on to my website, sir, which is www.doctorsharmila.in. It's drsharmila.in. It's a simple...
there you are.
Yeah, they can log on and they'll get all the details.
Great, Dr. Sharmila. It's been an eye-revealing discussion on women and their problems after menopause.
Yes.
And you've explained it so beautifully that I think even the laypersons have got a good idea of what is entailed. Thank you very much once again for being with us.
Thank you so much for having me, sir. It's my honor and my privilege. And
we shall have more of such discussions in future.
I look forward to them, sir. I look forward to them because male and female sexual health is really of a great concern, and it encompasses the future. It's not about the present, but it's also about the future. Then there are a lot of topics, both in male sexual health, as you know, you're the specialist, and female sexual health, which are completely virgin. They're untouched. And the lay men, they have absolutely no idea. They would rather go to a quack, get confused or medicated in a very, very improper way, which sometimes doesn't work. Still, it's okay, but they have a lot of severe reaction, and that's a very big danger. So I request all the viewers, please go to an authentic, a renowned doctor, do a background check, and please go, because that's extremely important. It's your health after all, and your sexual health after all.
Very important point. Very important point.
Yes, it's a
don't go to any quack, because they're going to make the matters worse.
Absolutely, absolutely. So, Dr. Saxena sir has been so thoughtful to open this channel for doing social good to so many patients and people watching, so that they get the right scientific knowledge. And he's having discussions with eminent sexologists and specialists. One should be very lucky to subscribe to his channel and follow it to improve their sexual health. And sir, I really appreciate this step of yours. And
thank you, Sharmila. I thought, let me go slowly. First, explain the concept to the public, and then, as we are discussing slowly, we'll want to the
Yes.
more intricate things
By
of
bit, because
sexual life.
it will be too much for them to take in also. So this was a very important topic, which is completely, even in the sexual health forums, they do not discuss about geriatric sexuality or menopausal sexuality or andropause sexuality. They do not. It's all about other topics, but this is hardly touched. So, sir, it was absolutely brilliant on your part to come out with this topic. Involved me too, and I'm so grateful and thankful to you. Please to come up with more of such informative and invigorating topics for our viewers. And viewers, you're really lucky to have Dr. Saxena's channel. Please subscribe to it. Please subscribe to it, because I already have, and you should too. Thank you so much.
As a benefit to the public, we will request you to come on and on.
Sure, sir.
As
and how the topic demands, I'm definitely a part of this channel. I'm a subsect. So whenever sir comes up with any topic on female sexuality, I will always be there. Should sir want me, I would be there. So that's, you don't even have to think about it, sir. I'm at your service and the service of our viewers. Thank you so much, sir.
Thank you. Now, viewers, if you have any comments or suggestion to make, please use the comment section. Or would you like, if you would like Dr. Sharmila and or myself to discuss on any other topic, let us know. But don't forget to press the like button and subscribe to this channel.
Double likes, 2 likes.
Thank you. And again, as the Duchess said to the Bishop, keep it up.